Greetings, everyone. Hope everyone has joined the session. Let me introduce myself for the new joins. This is Dr. Mohammed Jamil Ahmad, registered pharmacist in Saudi, registered pharmacist in India, currently working as a hospital pharmacist cum clinical pharmacist in Saudi Arabia. It's going to be a small session, like a FAQ session. There are some questions from the students, so I'm going to give the clarity about the session. By default your mic already is off, and if you have any questions you can raise in the Q&A section. Let's get into the topic. As you can see on the slide that we are going to discuss briefly about doctor prefix, like where to use and what is doctor prefix, who can use, why to use, all these concerns we can discuss in this topic.
Also, we have Telugu audience, so I discuss in both languages, Telugu and English. Please be patient, English audience, and also be patient, Telugu audience. Prefix doctor is a salutation before the name we use, usually which indicates the academic qualification of a person. For example, we can use Mr. for men, Mrs. and Miss for women, for children, Master. If the female child, we use masters. So like this, if a person having a highest education any of the field, so we will use ప్రిఫిక్స్ డాక్టర్. సాధారణంగా మనం పేర్ల ముందు డాక్టర్ అనే వర్డ్ విని ఉంటాము. సో అందులో ఏంటంటే డాక్టర్ అనే వర్డ్ అనేది ఏంటంటే బేసికల్గా వాళ్ళు చదువుకున్న క్వాలిఫికేషన్ని చూపిస్తుంది. సో ఎంతవరకు చదువుకున్నారు, హయ్యెస్ట్ ఏదైనా ఫీల్డ్లో వాళ్ళ హయ్యెస్ట్ క్వాలిఫికేషన్ ఏదైనా ఉంది అంటే అది చదువుకున్నారనుకోండి, వాళ్ళకు డాక్టర్ అనే ప్రిఫిక్స్ అనేది యూజ్ చేస్తారు. నెక్స్ట్ క్వశ్చన్, ఓన్లీ హెల్త్ కేర్ ప్రాక్టీషనర్స్ కాల్డ్ యాజ్ ఎ డాక్టర్. ఇది ఓన్లీ మిత్ మాత్రమే, దీంట్లో రియాలిటీ లేదు. హెల్త్ కేర్ సెట్టింగ్స్లో అంటే హాస్పిటల్స్లో పనిచేసే ఫిజిషియన్స్ ఓన్లీ డాక్టర్స్గా పిలువబడతారన్నది రాంగ్ ఇన్ఫర్మేషన్. సో ఎవరైతే పిహెచ్డి కంప్లీట్ చేసి ఉంటారో, ఎవరైనా సరే పిహెచ్డి కంప్లీట్, బేసికల్గా మన ఎడ్యుకేషన్ సిస్టమ్ ఎట్లుంటుందంటే ఎస్ఎస్సి ఉంటుంది, ఎస్ఎస్సి తర్వాత +2 ఉంటుంది, +2 అంటే ఇంటర్ తర్వాత డిగ్రీ చేస్తారు, డిగ్రీ తర్వాత పీజీ చేస్తారు, పీజీ తర్వాత పిహెచ్డి చేసిన వాళ్ళు ఎవరైనా సరే వాళ్ళకు డాక్టర్ అనే ప్రిఫిక్స్ ఆటోమేటిక్గా బై డిఫాల్ట్ వస్తుంది. So this should be in your mind. By default it will come according to our education system. We have to complete SSC and then inter and then degree, which is undergraduation, and then post graduation. After post graduation you will be selecting a subject. In that, if you are a expert, then the university will issue a certificate. Then you can use prefix doctor. Also you need to understand that every doctor is not a PhD, but ఎవ్రీ పిహెచ్డి హోల్డర్ కెన్ యూజ్ ప్రీఫిక్స్ డాక్టర్. ఇంకో విషయం మీరు గుర్తుంచుకోవాల్సింది ఏంటంటే, డాక్టర్ ఉన్న పేరుకు ముందు డాక్టర్ ఉన్న ప్రతి వాడు పిహెచ్డి చేయరు, కాకపోతే పిహెచ్డి చేసిన వాళ్ళందరూ డాక్టర్ అనే ప్రిఫిక్స్ని యూజ్ చేయొచ్చు. అదేవిధంగా పిహెచ్డి హోల్డర్ అయిన ప్రతి వారు ప్రిఫిక్స్ డాక్టర్ని యూజ్ చేయొచ్చు, కానీ వాళ్ళందరూ ఫిజిషియన్స్ కారు. So I mean understanding you, right? So every PhD holder who has prefix doctor, he is not a physician. Just it is like, the academic it shows, it indicates only the academic qualification of a person. It's not completely physician things. So I mean this is different thing and this is a different thing. To clear this myth, I am making this video. Okay, సరే, మరి మనం రెగ్యులర్ మన డైలీ లైఫ్లో ఉన్న హెల్త్ ప్రాక్టీషనర్ ఏమనాలని చెప్పేసి మీరు నాకు డౌట్ ఉండొచ్చు. సో దర్ ఇస్ అ క్వశ్చన్ దట్ వాట్ షుడ్ ఐ కాల్ డైలీ లైఫ్ హెల్త్ కేర్ డాక్టర్స్. సో జనరల్లీ యూ కెన్ కాల్ దెమ్ యాజ్ అ ఫిజిషియన్ ఆర్ సర్జన్, రైట్? They have studied highest study in the healthcare settings, so the universities are awarding their degrees in front of their name with the doctor prefix. So doctor prefix is an only absolutely only for the academic qualification, shows academic qualification. అంటే ఈ డాక్టర్ ప్రిఫిక్స్ అనేది ఓన్లీ వాళ్ళు చదువుకున్న అకాడమిక్ క్వాలిఫికేషన్ మాత్రమే చూపిస్తుంది. సో అదేవిధంగా వీళ్ళను మనం ఏమని పిలవచ్చు అంటే ఫిజిషియన్స్, అంటే వైద్యులు లేదా సర్జరీ చేసే వాళ్ళైతే సర్జన్ అని చూపించవచ్చు. సో అట్లనే కొన్ని విధాలుగా నేను కింద ఎవరెవరు స్పెషాలిటీస్ వాళ్ళ స్పెషాలిటీస్ ఏమున్నాయో దాని ప్రకారం వాళ్ళని ఏం పిలుస్తారు అని చెప్పేసి కొన్ని స్పెషాలిటీస్ ఆల్రెడీ కింద స్లైడ్లో ఇచ్చాను. సో ఐ విల్ డిస్కస్ అబౌట్ దిస్ ఆల్సో. ఫర్ ఎగ్జాంపుల్ లెట్స్ సే ఐ హ్యావ్ కంప్లీటెడ్ మై డాక్టర్ ఆఫ్ ఫార్మసీ విచ్ ఇస్ అబౌట్ 6 years. ఆల్సో దే మెనీ ఆఫ్ ద పీపుల్ దే డోంట్ నో there is a course called Doctor of Pharmacy. So see, there are differences. Diploma in pharmacy, diploma in the sense it is 2 years, and then Bachelor of Pharmacy, it is about 4 years, and then Doctor of Pharmacy, which is 6 years, includes a 1 year internship. We are practicing in hospitals also. So these things you must keep in your mind. So there are 3 categories approved by Indian government who can called as a pharmacist. Diploma in pharmacy 2 years untundi, only 2 years, and then Bachelor of Pharmacy 4 years untundi, and then Doctor of Pharmacy, which is 6 years, and then even if you have completed Bachelor of Pharmacy, and then there are there is one more bilateral course, like after completion of your B Pharmacy, you can take into admission the post baccalaureate PharmD, Doctor of Pharmacy, which is 3 years. So you should keep in your mind these topics to be understand. When it comes to the course Doctor of Pharmacy, as I told you already, it is the highest qualification in the pharmacy field, which is 6 years, which includes the 5 years of academic education and 1 year of internship. So totally 6 years. The MBBS and the PharmD, both of them, the maximum syllabus 80 to 60 to 80% syllabus is same. Like they study about human anatomy, pathophysiology, microbiology, clinical pharmacy. The pharmacy is only educated and we are trained for the treatment related things. We are not trained for diagnosis, even though we have the knowledge how to diagnose and how to treat the patient, but we are not authorized to diagnose the patient, and the treatment purpose we are authorized. So the MBBS, the same syllabus they also having, but they are more advanced related to the diagnosis. So they are trained under the for the treatment and diagnosis. They are like, it's like a, this program is like a triangle. As you can see in the picture, the patient will be the center point, and the pharmacist and physician will be the supporting for them. In might be there is not much importance for the pharmacist, but when you come to internationally, there is a huge respect, huge importance for the pharmacist. So in upcoming videos and in upcoming lectures, we will discuss about the role of the pharmacy and the patient care, medication management, medication review, regarding the side effects, adverse effect, related to everything we will discuss in detail. And also I request you to respect everyone's profession. Even he's a physician, even he's a surgeon, even he's a pharmacist, nursing, and also nursing department has a huge respect actually. So we cannot ignore anyone. Now let's discuss about the specialities of the physicians. So some of the examples I have given, so we can discuss about this. Like immunologist, so who deals with the immunological things, diagnosis and monitoring disorder involving the immune system. Immune system is nothing but the body responsive systems. For example, if our body faces some problem, by default our body produces heat, so that's why we faces fever. So this is called immune system. Our immune system, our body has its own repairing system. So this is called immune system. Related to this, if any physician is specialist studying in this topic, so he will be called as an immunologist. Next, anesthesiologist is nothing but like who is expert in loss of sensation uh, before the surgery. If we are cutting some body parts of ours, so we will feel pain. So if a person is specialist in that topic, so he will be called as a anesthesiologist. If a physician is treating related to the cardiac problem, heart related problem, right, blood pressure, low blood pressure, high blood pressure, anything related to our heart, so he can be called as a cardiologist. And the dermatologist related to the skin problems, whatever we have, the dermatologist will deal. endocrinologist. So specially endocrinologist actually, like diabetic is endocrinologic problem. So hormonal related, even for the female or male. So related to the hormones related, any treatment is going to be done by endocrinologist and family physicians. Normal checkups, whatever the things we face in daily life. So if we go to the family physicians, and then they will refer to, if whatever the basic fever and the headache, pain, basic things, whatever the general things we faces, for them, if we go to the family physician, if it is under their jurisdictions, they will treat us. If it is not, then they will refer to the specialist. Gastroenterologist, he deals with related to our GAT, gut, related to the stomach infections like appendix, or the ulcer, whatever the related to our gut problems, he deals with that. And the neurologist, he will deals with brain, spinal cord, and nerve related treatment. About psychiatric, he specialized in mental health, including the substances use disorders, like whatever the mental problems are there, like schizophrenia, and then parkinsonism, different things, whatever the mental related problems, he will deal. This physician will, pulmonologist, related to the our lungs, whatever the problems like asthma, we can see COPD related problems, the pulmonologist will deal. Related to the problems of the children's, like newborn, neonate, children's, all pediatrician will be diagnosed, and the treatment will be done by him only. And this physician radiologist, you have seen maybe there is some X-ray, MRI, and then different radiological programs to diagnose the patient's exact problem. You know, for this kind of treatment and diagnosis thing, radiologist will deal. And the surgeon, if you want to remove some body parts from your body, if you want to repair some eye or something like that, for that the surgeon will be dealing. And hematologist, related to the blood related disorders, whatever the blood related disorders we have, the hematologist will be dealing with that, like anemia, thalassemia. These all are the some specialties. For example, I have already described. These all are like like the engineering specialties. In engineering also they will have, like civil engineering, electrical engineering, mechanical engineering, aeronautical engineering. Likewise, different categories as they have. Likewise also, here we have specialties. Thank you very much for joining the session. Tomorrow's topic I will share you in the group. Thank you. See you again.